Hi, everyone. My name is Andy Harrington. I'm the Executive Director of Canadian Food Grains Bank. I'm coming to you live here from Juba in South Sudan. We're being hosted by Tier Fund South Sudan, the partner of Tier Fund Canada. That's one of our members here on their compound. We've had a great week with them, and you'll meet some of their staff later on. Now, because I'm coming to you live from Juba, we just don't know if this is going to work. We're trying something wild here. We've got people coming in from Nairobi and all over the place. So should this live link go down, come back on Thursday at this link, and we'll actually be we'll be doing this from Canada. So we just want to make sure you get a chance to do it. So we'll get back together on Thursday, but hopefully that doesn't happen. We're also going to be the other thing that will happen is if we do go down, do stay on board. Megan Silenso, my colleague in Canada, will be jumping on and actually be able to ask some of the questions from some of our participants from around the world. So either way, we've got you covered. Now, just to say, it's been a very deeply moving week. We've been here all week in South Sudan. We've traveled up to the north in a place called Awil, right on the near the border with Sudan. We've been in a refugee camp, and we've seen incredible suffering in a place that has known incredible suffering for a long time. We've seen malnutrition centers. Malnutrition stalks hundreds of thousands of kids' lives here and parents. We've heard from refugees and from returnees that you'll hear from yourself on videos, really harrowing stories. But we've also seen hope. It's hard to believe that that would be the case in a place like this, but we've seen hope as we've seen partners like Tier Fund, like Zoa Dorcas, who you'll hear from later on, and others, doing incredible life-saving work and bringing hope to those who would be hopeless otherwise. So it's a few months ago, we started thinking about this webinar. At that time, we were hoping to get into Sudan. We couldn't because the situation is too dangerous there. But we've had a chance to really tell you a little bit about that in a video we're about to show, because it's a place where people are dying because of hunger and conflict. There's violence, there's flooding, there's droughts, there's even locusts now. The whole thing's coming along. So, it's a very, very difficult situation. So in order to give you an idea of that, have a look at this video.
Sudan is in crisis.
Okay.
So why are we not paying attention? In April 2023, violence erupted in the capital, Khartoum, plunging the country into chaos. Families were forced to flee their homes for fear of their safety, leaving most of what little they owned, including their farms and other sources of livelihood. The conflict disrupted food production, supply routes, and market systems. Humanitarian aid became extremely difficult to deliver. Now in 2025, more than 24 million people, half of Sudan's population, are facing acute hunger, which means high levels of malnutrition, eating once a day or less, and selling what they can to buy food. And if that's not bad enough, people are dying of hunger. A famine was declared in a refugee camp in the Darfur region last August. Since December, it has spread to multiple regions, with even more people being at risk in the coming months. Conflict drives hunger. When people flee, they leave behind homes, farmland, and livelihoods. Supply chains collapse. Inflation soars. Food becomes scarce, unaffordable, or completely inaccessible. And when humanitarian aid is blocked, communities already in crisis cannot get essential food, water, and medical care. Sudan is now experiencing the worst displacement crisis in the world. Over 12 million people have been forced from their homes, and more than 3 million are fleeing to already struggling neighboring countries like Chad and South Sudan. The hunger situation is being made worse by a poor harvest due to drought and a locust invasion. The need for humanitarian aid has never been more urgent. Visit foodgrainsbank.ca/Sudan to learn more and support life-saving efforts. Together, we can make a difference.
Incredibly difficult. In fact, the numbers have got even worse. Since we filmed that video, we found that there are now 30.4 million people in need, and that includes 15.6 million children. More than 12.8 million displaced, both in Sudan and two neighboring countries like South Sudan. And now, right in the middle of that, we've seen the cuts that have happened to USAID. It's not just USAID, it's others around the world. And what that's meant is a situation that was incredibly difficult is becoming even bleaker. So there was a huge amount of work that was being done by USAID there. and the ecosystem that we work as part of development agencies has really been destroyed. So to actually tell you a little bit more about that, I'm going to introduce you now to a guest of ours who's coming in from Nairobi. Duke Nyancho is the finance officer, the finance and operations manager for Trocare Sudan. That's one of our partners. They're a partner with our member Development and Peace Caritas, and they do amazing work around childhood nutrition. We support them in programs in Somalia and elsewhere as well. We wanted to be able to talk to Duke in Sudan, but he actually can't go there at the moment because the situation is too dangerous. So I hope you're with us, Duke, and welcome here.
Thank you very much, Andy. Thank you for inviting us to this webinar.
Well, it's great to have you, Duke. I wonder, can you please describe the situation that's happening in Sudan at the moment?
So the situation as it's happening now, I think looking at the video that has just been shown, the situation is worse, and we would say it's the world's worst humanitarian crisis that we've faced in the recent world. The situation is characterized by a protection and displacement crisis, with over 30.4 million individuals in need of humanitarian aid. So we have about 12 million of these displaced, 8.8 million being displaced internally. And we have about 3 million now going into the neighboring countries, which are also struggling with the influx of these populations. So it's also important to say that we have about 17 million children who are out of school at the moment, and about 4.3 million people at the age of famine since we've declared an IPC 5 in parts of Sudan. So it's a really tough crisis, and I would say this is a very complex situation that is also coupled by lack of funding, no media attention in Sudan, as we've seen in other parts of the world. Yeah. So it's a really challenge, and such webinars are important to highlight what is happening currently.
Well, Duke, it's really hard to hear that, to be honest. There's so much need, and we hear these numbers, and sometimes we just have to put a face on them as real people. But can you tell me a little bit about how the cuts to USAID are impacting your work in Sudan?
Now, given the numbers that I've just presented or highlighted before, so there was a lot of hope from the humanitarian community as we started receiving the IDPs and the returnees coming in, fleeing Sudan, the war in Sudan, and also famine. But now we were hit by a shock in early January, December, with the freeze in the USAID cuts. So I would like to say that TROCRA is not affected directly, but two of our partners are affected. And I would say that they were being funded, almost 80% of their costs were being funded by USAID. So you can imagine the amount of crisis that we are facing now with that cut in prices, and seeing more people going home who are being relied on by the communities, because it's also important to remember some of the staff who are working for us are also hosting a number of returnees, apart from the people that we have in the IDPs. So some of these people have lost their livelihoods, and really it's a challenge on how they're going to handle this. So it's a big crisis, and it's going to affect us greatly. So any help that can come in from the Canadian people and also other interested parties, it would go a long way to support in terms of managing the crisis that we are currently facing.
I can only just imagine, Duke. I mean, in terms of the way that this has happened, just to have 50% of the global aid funding cut like that must have incredible ramifications. But as you do that, as you think about those cuts to USAID, what do you think about your programs and what they've achieved? What do you want to share about how aid makes a difference to communities in need?
So just to put this into perspective, so the crisis that we have is both, so we are looking at health and nutrition issues, because high cases of malnutrition, food security issues, because now there is famine, IPC 5 being declared, and I would say that our program has reached more than 600,000 people with the integrated health and nutrition programs. And this year, thanks to different sources of funding, including the Canadian Food Grain Bank through our partner Development and Peace, who have given us, hope that there's somebody out there who's willing and who feels the plight and the challenges that the people of Sudan are facing. So with that, we've prevented so many deaths through our nutrition program. And just to paint a small picture of what we've been able to do, we have children and women who are walking into IDP camps after walking for over 3, 4, 5 months into the camps. And the only way to save these children and the women is through the nutrition supplies that we are able to give, or the nutritional interventions that we have in the camps. So Sudan is also characterized by rains, long rains, monsoon rains, which comes with a lot of outbreaks and all that. So the funding that we are receiving is going a long way to help mitigate some of the catastrophic crises that we are looking at.
Right. Thanks for sharing that. And some people say that aid doesn't work. I think you're an example of a true example of that it does. But I do have a question for you. We've talked about some of the very difficult things that are happening. How do you find hope, Duke, in all of these humanitarian crises that you work in? When we talk about children being malnourished, when we talk about aid just being shut down like that, where's your hope? How do you carry on?
It's honestly difficult to carry on in such a situation when you see children and mothers dying because of the crisis that there is. But one of Chopra's values is perseverance. We work in a difficult place, but then it's on us to show some strength, to show some courage in working the area. Then also looking at the people who are supporting us. There are people who are putting hands in their pockets to give us the small that they have to support this region. Then the last thing is seeing these children and the mothers getting help and looking at us as a source of hope in their hopelessness. That gives me a motivation to continue working in such an environment.
Duke, thank you so much for joining us tonight. It's incredible to hear what you're doing, the care and compassion that your team show to those in the most vulnerable situations is totally inspirational. We're so proud to be able to stand alongside you. So I really want to thank you so much for joining us, Duke. Thank you.
Thank you so much.
It's an incredible work that Duke does, and he's just one of many people that make the aid work around the world, that come alongside millions of people. I'd like to introduce you in person now to another one of those. We've been here, as I said, in Tear Fund South Sudan's compound all week. And so I'd like you to introduce to you Erickson, who's the country director here for Tear Fund. He's a very tall man. I'm a very short man, so we're going to be going up and down like that. But welcome here, Erickson.
Thank you very much, Andy.
Tell us a little bit about the work of Tear Fund here in South Sudan. What is it that you do, and how do you make a difference in the world?
Yeah, thanks a lot. First and foremost, it's a great pleasure to host you at our office in Juba. So Tear Fund provides both life-saving and also resilience kind of services to vulnerable communities across South Sudan. We are present in 5 out of 10 states in South Sudan. So we work with a number of donors, supporters across 5 continents. And we're very grateful for the support that CFGB and Canadian people are basically providing to ensure that we deliver aid to those that need it the most. So Tear Fund provides life-saving services to people affected by both conflict and also natural disasters like flooding and other kind of types of issues. So we provide clean water to these people. We also provide hygiene and sanitation services to them. For instance, this year, one donor has supported rehabilitating 68 boreholes.
Oh, wow.
That benefited.
And water is life here, isn't it?
Yeah,
so that's
water is life. Yeah, that benefited 35,000 people. We also provide primary health care services. We run health facilities through our local partners. And in the last couple of months, cholera outbreak has basically, affected so many people. We have seen people losing their lives. So Tear Fund is there at the forefront, with local partners to be able to provide these services. We also provide food security and livelihoods.
And actually, let me just ask you a little bit about that, if I may, because we've been up in the refugee camp in Awal East. We flew up there this week. We spent 3 days there. We visited some of the participants on the projects that you've run there. Tell me a little bit about that food assistance you do, but more than that, tell me about what it's like for the refugees in that camp.
Yeah, in Awil, like other parts of the country, we are really working with the communities, local leaders to be able to support these communities fleeing the conflict in Sudan to be able to seek safety in South Sudan. So we are working with CFTB through TIA Fund Canada to be able to provide food to these people so that they can basically thrive in this difficult period. We are also planning to start a project, food security project that is supported through TIA Fund Canada CFTB partnership, that will see some communities in Awil basically get facilitated to put food on the table without any external assistance.
And we met some of the refugees there. Tell me a little bit about their life, what it's like for them, as much as you're able to. We're going to actually hear from some in a minute on a video, but from your perspective, because it was pretty harrowing, I've got to be honest, in what I saw there.
It's very hard. These refugees have gone through a lot, fleeing the conflict in Sudan. Here in South Sudan, we are talking about slightly more than 1 million people who have basically fled the conflict in Sudan. And these people basically cross the border without literally nothing. So they need food, they need shelter, they need their basic needs to be met, including clean water and also safety. We have seen communities basically extending support to them even before international humanitarian organizations reach them. And we are also leveraging in our partnership with churches in South Sudan to be able to support these villages.
It's actually interesting you should say that, because we visited a village yesterday, and that village was hosting returnees, so not refugees who come from Sudan, but people who've gone from South Sudan because of some of the issues here, settled in Sudan and are now coming back because of the war that's in Sudan. And one of the things that I found absolutely fascinating was that we were meeting people who had nothing. I mean, literally nothing. They've been food assistance recipients themselves, but they were actually hosting people who came back with nothing themselves. Why do they do that? What is it about the community that makes someone say, I have nothing, but come into my house? I've never met you, but come into and be part of my family.
Man, that's out of humanity or human, even as part of the African culture, when you have a visitor, you have to basically extend support. So we have seen that happening in South Sudan, where the host community basically provide the little support they have to these refugees and returnees. So it's a good thing, and
it's a great thing.
Keep encouraging it, and even the church to also take the lead in responding to those needs and support these communities.
And just one final question. I mean, we heard from Duke just now about some of the difficulties that the cuts to USAID has caused. When we talked privately just a couple of days ago, you were telling me some of the things that it's meaning. You were talking about your malnutrition program, your childhood nutrition programs being cut. What's going to be the impact of this? And it's not just USAID, it's other countries as well. What is the impact of taking that life-saving aid away from a place like South Sudan?
Before tackling that question, I would just want our viewers to be able to understand that the humanitarian context in South Sudan is dire, very dire, and funding has been shrinking over the last couple of years. In as far as the USAID funding is concerned, it's supporting 7 health facilities, plus about 27 nutrition sites across 4.
And this would be for children and mothers.
For children and breastfeeding mothers. And those pregnant mothers as well who come to seek nutrition support. So it means these 7 health facilities, 27 nutrition sites will be will not be there anymore.
And what does that mean? I mean, let's just be honest about this.
Losing lives. So people basically die. And we are in a very difficult situation where we are supporting patients in our hospitals to recover from cholera outbreak in this country. So far, we have lost 38 lives in our basically 7 clinics across Jonglei State. So we're basically calling for support. We have our partner TF Fund Canada, who is also doing their level-based basically to be able to work with CFTB and other donors and the community in Canada to be able to support our work in South Sudan.
I will ask one. I said that was my final question. I want to ask you something else. I've so enjoyed meeting you this week, and I've just loved meeting your team and the atmosphere you have here. How do you do it? How do you keep going on? I mean, we're talking about deaths. I know that you go and you see things. This must be incredibly distressing at times. How do you carry on, Duke?
Yeah, it is indeed. Even the heat wave in the night, I think
I don't think we told people how hot it is here.
Yeah, it's very, very hot. The temperature varies from 40 to 45 degrees. Yeah, it's really very difficult. I mean, it's just because it's just beyond work. It's a calling to basically do our part in saving lives. And we can't do it without CFTB. We can't do it without TF Fund Canada. We can't do it without Canadian taxpayers who are basically giving money to support these communities. So we believe our role is very limited. And we are also very grateful to basically, see you coming to visit those.
I feel very humbled by that. I know who does the real work here. And I'm just so grateful to you and for your team for hosting us this week. You've been absolutely phenomenal. But seeing the work you do is incredible. So thank you so much, my friend.
Much, Andy.
It's been a joy. Thank you.
Thank you very much.
Incredible team here at TF Fund South Sudan, and they've been hosting us, as we said, all week. We spent a few days up in a state called Northern Bahr el Ghazal. It's in the northern part of the country near the Sudan border, and it's a community there that we've been in where hunger is prevalent for thousands of people. The refugee camp was a sight to behold, let me tell you. And that is actually before, but it was difficult before the violence broke out in South Sudan. Now it's a lot worse. It was a few days of heartbreaking stories, knowing that the situation is going to get so much worse as countries are making cuts. And those paying the price are the people who live there. And the reality is that some of those people are going to pay with their lives. I want to introduce you to some of the people we met there. We filmed these videos. Our team, Christina and Femi, have been filming amazing videos all through the week. So in this video, you're going to meet Miriam. She was a young refugee we met 2 days ago. We met her in a refugee camp that we were able to fund through our members, TF Fund Canada, and their partners, TF Fund South Sudan. We're able to provide some much needed food, but the needs are so huge there, we can only do so much. And actually, we found out that what some people were saying when they were speaking to the authorities in the area, they were struggling so much that they said they were being asked, is it better to die in the war or to come here and die of hunger? And that is the reality you have. So we also visited a community that was hosting those South Sudanese, as I mentioned to Duke. South Sudan is one of the poorest countries in the world, and thousands of these people left to find refuge in Sudan because of that poverty. Now the war's broken out. They've fled war. We've met people who've lost family in that war, and they're coming back with often nothing but the clothes on their back. So people spoke of Tear Fund and Zoa Dorcas, who we also met as another one of our partners and members there with World Renew. People spoke of these organizations as a pillar of hope in a hopeless situation. And finally, we visited a community where we worked last year. We're actually going to be starting another program there with World Renew for their partner, Zoa Dorcas. And we met Mueni. She was a lovely lady. She put a necklace on my head, and many of us danced together. It was an incredible time, but I was very aware that we were doing that in the midst of absolute poverty and hunger. And she has a message for all of us, and it's a moving video. So please listen, please watch, and hear the voices and see the faces of the people really struggling to survive here.
مريم عبد الماجد لأنه هناك ما في أمان وحرب وفقدنا ناس كتير يعني حتى عند أخواني برضو توفوا بجراء الحرب والقصف والطيران ومشاكل يعني ما في أمان هناك، ما لاقين أمان، فطلعنا نفتش في أمان عشان نكون سعيدين وآمنين في مكان ما. أي زول الشتت يعني، طلعنا أمي برا وأنا وأخواتي 2 برانا، وبعد ذاك عند أخواني 2 طلعوا مع خالته وتلاقينا كلنا في الضيم. والله المعسكر من جينا كويس، لكن برضو ما لذاك يعني، الحمد لله ناكل ونشرب، لكن برضو ما زي اللي احنا دايرينه. وفي أكل متوفر من شهر لشهر، لكن يعني لو بقينا أيانين ما قاعدين نلقوا العلاج في الوقت المناسب، ما قاعدين نلقوا يعني ما قاعدين نلقوا أمان للدرجة ده، بس الحمد لله. والله السبب هما ناس كتار ما بقدروا يوفروا لك أي حاجة. مرات بكون نحتاج قروش، حتى البصل والزيت، ومرات بكون بنتهي بصل وزيت والحاجات التانية دول، ما هو بصرفوا لنا دقيق وحاجات ديل بس. مرات بكون ما عندك قروش إلا تضطر من الإتا صرفوا لك تمش تشتري عشان تجيب لك بصل ولا تجيب لك حاجات الغذائية التانية دول. وبالذات زلوا أيام مثلا داير تأنقذ وما في قروش، ما عندك قروش وإنت ما شغال وما عندك رأس مال عشان تشتغل تجيب حاجة تساعد بو ناس البيت، وبكون انت محتاج احيانا تقوم تشتري حاجات اللي انت المفروض ما تشتري عشان تجيب خزة تاكله في نفسك. والحاجات الدقيق والزيت والعدس البدونة ده ما متوفر انه زول يمسك زول ايام حاجة بالشكل كده. انا والله داري يوفروا لي الامان، وداري يوفروا لي امل انا اشتغل فيه عشان اقدر اساعد ناس البيت واساعد نفسي. داري لا اي حاجة يكون يعني أقدر أنا أأمن في مستقبلي وأعيش بأمان عشان نقدر نقعد هنا نفكر في مستقبلي وكي داير أشتغل، داير ألقى أي حاجة أشتغل فيه. والله الحمد لله كان الوضع هناك كويس يعني، شغالين برضو برزق يوم باليوم يعني، قاعدين ناكل ونشرب والحمد لله عايشين. بس بعد المشاكل ده كل الحاجات اللي عندنا راحت، وهسه ما عندنا أي حاجة يعني. جينا هنا أي زول عنده لبسة في جسمه بس ما جينا بأي حاجة تاني يا أخو. جينا هنا بعد ذاك المنظمة لاقتنا والحمد لله هسه عايشين برضو ما زي اللي احنا دايرينه يعني.
أنا دين so أنا روانشة أنا روان تديك كدرو وأنا ندير بايتن بجال جال بلا جور ريل شو ريل جرباني بطوار توينوار ريل وقتن كنالوار كجوك مشاكل تنو كجوك تنو kayan mit cia ciban rel tan kai aging go mit ken war chingi jang tu ka jaban ale ke la kai tan pi ruk tun wa ta ur kayan ana chugwa ban yung mana zum bai tan mana zum dat kai ko chier pan ciban ben tan kwa chu ku kwa rel Sudan mi da Sudan amit pa pa amit in yo we ju pa bala su bala oi ku darat ku in wa ja kadang met ci men ring ku kwat kri ben ka ko fa da Sudan atau kunai beitan wa long ban beitan chin mit fat ci ka chu ko yok ka che la yok rin de chinin we ko in chin talerin geu ku baka patwar chit kay war cham lang tui baka le hu baka ha chin te chin en ko inten ke in gan me ti men di tan o tan men tim chol thoi ken ne tim ne ko wa dong ku na lang ke rai tet man kur rin yai kan yari chul lup lup kuran di de ya kala yai thio de ken ku na gup ai diang ko ni nan ngwen ku ba diang pi ra kin man kur ken ai me gup tin ku ne ye ni twai ji ke tan ne ko jam ai cho là nó cái bên ya ko ga jam ka kuma ene ma jafan kan bugle ke le we ya ka jam ko men zama da lamia a chan ku bi ko nyeri no wa chi anyot nyot da ji tong ben tiam ari no wa da chi la chi rai ka ken war ke chi pur ke yo ku ten war ko pur ko war a chi la ka chi bo rai ko wa chi ko kiriak ban ni yok ke nin ka i ban Sudan a chi ben ko ga ngor lim den akuma ku bi men zama lamia bi ko na chi tir fan ka na chi aran pa pa chi men chi ro jot kan da ay ku le bu ko inde ban loi tan ka chap chit kan ayo kunya ya ayo kule kunya le kubului ka we ga god pot ba ka padoi tanu.
My name is Neri. I'm a South Sudanese. A host community, not a Chinese. I'm 33 years. Yeah, I have 3 kids. Firstborn is 7.5 years, and second one is 4.5. Third is 10 months. I have 17 people in my house with me now. I feel so bad because they have nothing to eat, they have where to sleep, they don't have anything like clothes. We are 6 in my family, we are 6 in, and then 11 people came in. Now make 17 of us in the house. But now like 5 days now, I don't have anything. Like there is a house there, we 2 kids passed away the same month, but different days, just because of food. If you were there, they could have not gone. But sorry for them.
2 children passing away in the same house and being told that if you were there, it wouldn't have happened. It's very, very hard to be in the room or on the field, actually, when you hear that at a time when so many people are stepping away from the situation. But we do have a little bit of good news tonight to share with you. I can tell you the government of Canada isn't stepping away. There's a lot of talk about aid and corruption at the moment. This is where aid goes. And we've just been told that we're going to be receiving $4 million to help in Sudan with life-saving help that's going to be given by the government of Canada, by Global Affairs Canada. We're going to be able to help 27,000 people through 3 members and their locally based partners. ADRA Sudan, part of ADRA Canada, is going to be one of those grant recipients as well. And actually, right now, joining us from Port Sudan is Zaid from ADRA Sudan. So Zaid, welcome here.
Yeah, hello everyone. Hello Andy. Thank you very much for inviting me for this webinar. Yeah.
It's great to have you here. We didn't know if we'd be able to make this work all the way from Sudan. So can you describe a little bit about the current situation there, how it's affecting people? How is ADRA Sudan doing?
Yes, actually the situation in Sudan is devastating. Imagine that a third of the country population has been displaced, and the majority of them from the capital state Khartoum to the other cities. As a part of a Sudanese rooted culture, every family has hosted displaced families in their homes. However, there is still many of IDP's thousands has not been accommodated within the host community, where instead they have been accommodated in schools and university dorms. Those millions of displaced families have put immense pressure on cities that are not prepared to receive such a huge amount of people at the same time in terms of infrastructure, which had led to shortages in basic needs such as shelter, food, access to clean water, and sanitation. And regarding to this, yeah, ADRA has made many interventions in food security and wash intervention and even shelter, trying to alleviate some of these challenges and needs from the IDBs and the communities there.
So thanks for sharing that. Just want to break in for a moment to say that if any of you have questions, we're going to have a question and answer session in a moment. So please do drop them in the chat if you want to ask us a question. But just coming back to you, Zaid, can you share how this impacts you as a Sudanese person? I know you've been internally displaced yourself. Here you are, you're working in the crisis, you're also suffering from the crisis. How do you cope? How does this impact you?
Yes, this, as you mentioned, this situation has deeply impacted me. Yeah, as a Sudanese person, I have been displaced with my family more than one time. Actually, it was multiple times, 3 times for me especially. And yeah, actually, we have been scattered as family. I'm saying family in Sudan, I'm not talking about the immediate family. I'm talking about our extended family. My uncles, cousins, aunts, we are all scattered across the whole country and even beyond outside the country. Yes, on the other hand, as like a humanitarian worker, I have witnessed the dire condition that displaced families are facing. Actually, I have seen mothers with their children laying on the ground without shelter, struggling to survive. And one of the most urgent needs that I have encountered that if they didn't or they don't have an access to clean water, where they need to travel like a long distance away to have to fetch water. Yes, and there is like as I mentioned previously, there is like many thousands of families within schools and university dorms, which we call them gathering sites, suffer from poor sanitation, lack of health care. Yeah, and like most of these households, they have lost their livelihood, they have lost their assets, and everything's behind now, and they are keeping, to resort the catastrophic coping strategy index, like to meet their food needs, such as like eating one meal per day, prioritizing children meals over the adults. Yeah, the conditions here is so harsh.
It sounds awful, Said, and I can't even begin to imagine, to be honest. But as you talk to a Canadian audience, what is it you'd like Canadians to know? What is it you'd like Canadians to do for those who are prayers to pray for?
Yes, first of all, I would like to thank the Canadian people because by the time this crisis has emerged, like the Canadian government, like have given like an opportunity for around 10,000 people of Sudanese to rejoin their families there in Canada. And we actually, as ADRA and humanitarian actors here in Sudan, we thank the Canadian people that they are keep supporting us in this tragedy by like supporting us in food security programs and other life-saving programs. And when, like, as a humanitarian actor, when you witness like a gratitude and smiles from mother and children that they have received support, this moment serves as a powerful reminder of the strength of of this human solidarity, the support people show one another even in the most difficult circumstances, have been among the meaningful experience that I have had.
Thank you
So,
so
yeah, I
much.
would like to take this opportunity, yes, Andy, to thank all the Canadian people for their unwavering support.
Said, thank you so much. I am so glad that we were able to make this happen. It's quite a thing to get to hear you from Sudan. We so appreciate the work that you and ADRA are doing. So Said, thank you.
Thank you very much.
Right now,
Thank
I'd
you.
like to welcome Christina Felix, my colleague, our Director of Resources and Public Engagement, to come and join me. Christina's been part of the team traveling here and filming and talking to some of the people. And I think you've got some questions, right, Christina?
Actually, the first question is for Duke, and it comes from Fatima Khalid from the Associated Press. There are reports of refugees going back to Sudan after feeling safe to do so. Have you heard about this? And when you speak or hear about them, are their homes in Sudan safe now? Are they controlled by the SAF? And what do you see are the situations that they're facing on a daily basis?
Thank you very much. That's a good question. And of course, as we said, there are about 14 million of these 13 million individuals who are in need are displaced within Sudan. So what is happening is that post 15th of February this year, when two factions of the army, that is the SPLM North and RSF, joined hands, there are people who had fled from areas that were being controlled by the Rapid Support Forces faction of the army. So with the two factions coming together, we've seen a number of people going back to their homes, but they're going back to same situations that they were in because there's no food. Most of the food commodities had been destroyed during this conflict. So they're going back, yes, but they're going back to nothing. Thank you.
Thanks, Stu. That is actually really leads into our next question from Timothy, and I'll pass it to you, Andy. It's clear that both South Sudan and Sudan are in dire need of help. What are some of the strategies used by various humanitarian agencies like yours to help these communities mitigate the cuts made by USA?
Well, that's a very good question. At the moment, we're still struggling with those cuts to figure out how we can what comes next. There was no warning of these cuts. And so if you can imagine, 50% of the global aid infrastructure has just been taken away. So right now, we're doing three things. First of all, we're triaging, trying to figure out what we can do as USAID leaves the scene. It's not just USAID. The UK government is just cutting aid by 0.2% as well. So the first thing is a triage to say, okay, what is life-saving? What must happen? What can we delay? The second thing is, for organizations like ours, we don't get USAID funding, so we can still be here. So we're just about to start 2 new projects here in South Sudan. And as you've just heard, thanks to the government of Canada, we're going to be starting 3 projects in Sudan as well. So we carry on, but we also need to figure out how to make some of those services work that we all take part in across the agencies that no one agency funds. It might come from 4 or 5. So you might have USAID cuts that have trimmed back on protection against gender-based violence and various other things that are part of our projects. So the second thing we're trying to do is to say, where are the gaps that we can fill that are essential for our projects to go, to work on. And the third one is really to start thinking about how the aid infrastructure is going to work in the future. If USAID doesn't come back, if aid funding continues to cut, we're going to need to look for other sources of funding, and we're going to need to be intelligent in the way in which aid works, a lot more reliant on local partners, a lot more reliant on local governments, and a lot more thinking through how, as well as responding to food assistance programs, how can we be around for a longer term so that when the next crisis starts, people have more resilience. We call it nexus programming. So we're starting to think some of these things through, but it's a great question. And believe me, we hope to have more answers in months to come than that. But at the moment, it feels like we've been hit by a brick and we're trying to figure it out. That's the honest truth of it.
Maybe one other question for you, Andy, is when you think back to these past few days that you've been here, you talk about it being one of your most moving experiences. Can you tell us what has spurred you on to keep going into this work?
I wasn't expecting that, Christina. I thought I was the interviewer here. Okay. So I've had decades of working in this kind of work in one way or another, including a couple of years living in a war in Bosnia and Croatia. I found this particular trip so moving because of the sense of desperation that was already here being multiplied by literally pregnant mothers turning up to malnutrition centers and them being closed. I mean, talking to a guy yesterday, a volunteer in a childhood nutrition center, and just seeing him and even myself and Femi was there filming as well, just being mobbed by women saying, help us, help us, help us. I mean, it was very distressing. So for me, in terms of hope, where I try and focus on is the people we can help. So Canadian Food Grains Bank generally helps about 1 million people a year. There's 757 million people in the world going hungry, many of them here in this country. So we have to focus on what we can do. And that's what I think the Canadian population has to do at the moment. As we are Canadians, we have had years and years of compassionate, humane leadership. It's not time to turn away. I might say a bit more about that towards the end of the podcast, but I believe there is hope, and you have to keep your eyes on that hope in the midst of what can be a very hopeless situation.
So that's all the time we have for questions right now. But if any of you ask any more, our team will be paying attention and they will respond to you back by email. And thank you all for joining us, and I'll let you wrap up, Andy.
Thanks, Christina. I appreciate that. I guess what I would say as we finish is that, especially for those watching in Canada, I know there's some people joined us from around the world. It is a very interesting time as we think about poverty, as we think about people struggling around the world. We seem to be becoming a more fractured world than ever before. And we seem to have a real issue in terms of remembering who we are as human beings. So our nation of Canada has long been a champion of freedom, compassion, and humanity. It's who we are. It's the values that we have. We've been a global leader in caring for our citizens and offering aid to hundreds of millions of people who are suffering from crises that plague the world. Hey, we're not a perfect country. We get things wrong. We know that. But Canadian aid is effective, and it directly impacts those who need it most. And we see that. I see that every one of these trips. I'll be coming home for 9 days off to Zimbabwe to seeing more projects out there. We have incredible accountability. We have incredible reporting. We do audits and everything. So when I hear that all aid is corrupt and goes to dictators, it makes me mad. It's just not true. Organizations like the ones that you've heard here tonight do incredible work and they do amazing work with very limited funds. And so when Canada comes alongside, we are met with great thanks. It means something to the people here that Canada isn't stepping back. So Canadian aid is being delivered incredibly well on the ground. It's working in emergency conflict zones. It's working in education, providing school care for millions of children around the world. It's working in healthcare, in childhood nutrition centers. It's strengthening local economies through sustainable development projects, and it's making a difference where it matters. And one of the things that's happening at the moment is the ecosystem that Canadian aid works in, that we as organizations work in, is being ripped apart. We're often working in the same community with other organizations. So perhaps we're doing a food assistance project, somebody else is doing a water and sanitation project, somebody else is doing a childhood nutrition or healthcare project. So when aid is taken from some of those other components of what's going on in the community, we can still do our work, but it's not as impactful as effective as when everybody's working together. So if you rip out massive parts of the aid system, like we've been seeing over the last month, if you just take away billions, $50 billion, the whole system is threatened. And sadly, when that happens, as we're starting to see here in South Sudan, putting it bluntly, people die. Aid is important and effective. And now is not a time for us to retreat. Now is not a time to turn our back on the values that make us Canadians. We share this world. And aid is an investment in all of us together. It's good for Canada. You know, we saw in COVID that things that happen in other countries come home. But it's also good for the people here, because what happens to one of us affects all of us. In the end, no human being is worth any more than any other human being. And I will take that belief to the grave. In fact, there are no others. There's just us, 7 billion or so people in the world. You may be an American, a Canadian, a British, a South Sudanese, a Sudanese, an Ethiopian, an Afghanistani. It doesn't matter. You are a human being. And when, you know, I think of those two children that Moeni talked about there, who died last week. The world is a poorer place because they're not in it anymore. And we have it within us as humanity to stop that from happening. So I want to ask you to join us. Well, here at Canadian Food Grains Bank, we have 4 ways we ask people to join us. First of all is give. And you can make a donation by visiting our website. You can donate to participating members, like you've heard some of our members doing, who will then get that funds directly through us to their local partners. Or you can give to the General Sudan account you'll see there, but we will take that money and it will be well used. So go to foodgrainsbank.ca/Sudan to find out how to do that. Also, learn. That's something else. As well as give, we like to say learn. Learn about what's going on. You can go and check out at foodgrainsbank.ca/Sudan more about those videos that you've seen here and others. But also look up Sudan and South Sudan on media. Check out what's happening. Get yourself educated about what's really happening, rather than just listening to 140 characters on Twitter from people who really don't know what they're talking about at times, to be honest. Thirdly, you can pray. Pray for peace. Conflict is rampant in this country and in other ones around the world. It's the #1 cause of hunger. There are 112 million people, probably more since those statistics were compiled, that have been forced to flee their homes as a result of conflict. So here in here in South Sudan, even this week, there's been some security issues. Sudan is at war. Please pray for peace. And pray for our member partners working in these horrible situations. You know, you've heard some of the stories today, and we've actually been talking to some of the staff here through the week, just hearing their personal stories of how they cope. So LMI is a partner of one of our members, Erdo, spoke about how their staff was trapped for more than a year while their city was under siege recently. And some were able to send their families away for safety, but many stayed because they're partners, that they work with people that they couldn't give up on. So pray for hope as well. Right now, we need that hope. And finally, let me ask you to advocate, especially in Canada. Right now, Canada is stepping up. It's not stepping back from its values. We have an election coming up, so please call your MP. Let your leaders know that international aid is a good thing, that it works. Point to organizations that are doing great work, not just us. Look at the Humanitarian Coalition website. Look at the Cooperation Canada website. If you're a Christian, look at the Kentro website. Hundreds of Canadian organizations doing amazing work, some with government funding, some with public support. We ourselves raised nearly $30 million from the Canadian public, and we're so grateful for that. So think through how you can learn and advocate and talk to your representatives and tell them that this is important. Our leaders need to know that we care about the rest of the world. So if someone knocks on your door and asks you for their vote, tell them that you care about international aid and we want to be a leader in this area. Canadian values, compassion, justice. It's who we are. So that's all from South Sudan tonight. Thanks for joining with us. We're going to go and try and get some water and get out of this 42-degree heat and get away from these mosquitoes. But believe me, standing here just in this is nothing to the suffering of some of these people. We want to be part of bringing hope. Thanks so much. Good night.